Welcome. My name is Aruna Arora. I'm the president of the Medical Association for the state of Alabama, and we are gathered here today to give you a COVID update. I'm pleased to announce our participants today. We've got Dr. Michael Saag, an ID expert at UAB. We've got Dr. David Thrasher, pulmonary critical care physician in Montgomery. We've got Dr. Daniel Neuberger, an ER physician in the Huntsville area. And then, of course, we've got our state health officer, Dr. Scott Harris. So Scott, if you don't mind, I'm going to let you go ahead and just give us a brief COVID update.
Sure, that sounds great. It's great to be with you. I appreciate the invitation. We look forward to doing a number of these updates in the future. Right now, we are seeing some pretty difficult times here in Alabama. We have seen a significant jump in our daily caseload. For the past week, we're averaging over 600 new cases a day on average. We've actually had a couple of straight days of over 1,000 new cases that have been reported. Just recently, as the July 4th weekend, Alabama hospitals were reporting less than 200 inpatients around the state on the days of that weekend. As of today, we have passed the 600 mark in terms of inpatients. Now, clearly, this is a lot less than we were seeing back in December and in January. At some point, we were over 3,000 inpatients, but this is a tremendous jump to see our numbers more than double in a couple of weeks, almost triple in a couple of weeks. It's interesting that the hospitals are reporting that virtually all their inpatients are unvaccinated. I don't think we're surprised by that. We have actually, in public health, gone back and looked at our deaths over the past 3 months since vaccine has been widely available to everyone. And about 97% of all the deaths that have occurred in Alabama since the 1st of April have occurred in people who were not vaccinated. We know that the vaccine products we have do a great job in protecting against infection, but they also, in case someone is infected, do a great job against protecting against serious illness and protecting against death. So we're unfortunately not surprised by the numbers that we're seeing. We're continuing to do outreach to make sure that we're reaching our most vulnerable populations. We know that our nursing homes have done a terrific job in terms of protecting their residents. More than 90% of our nursing home residents are fully vaccinated, although nursing home staff is really running about average for Alabama. Here in Alabama, we have around a third of the population, of the eligible population, that's been vaccinated. So we still have a lot of work to do on that front. We have now over 1,300 locations where people can get vaccine. There's no waiting, there's no cost, and as you all know, we are just simply having an issue with confronting the hesitancy of people that just haven't quite made up their mind. So that's just a little snapshot of where we are today. I'm going to turn it over to our experts. Let me start with Dr. Thrasher. Dr. Thrasher, what are you seeing in Montgomery now?
Well, last Christmas, Scott, after we had the vaccine, which I thought was an early Christmas present, I said, this is great. I predicted we'd have an independence day from the virus this summer. And just July 4th, I thought I was right. What I did not predict is that a large percentage of young people were not getting this vaccine. I think the vaccine is safe. It's incredibly efficacious, over 95%. Now, this weekend, it really changed for us. 2 weeks ago, our census over a weekend was 38. It jumped over 120 this weekend. Mostly what I was seeing is the COVID patients. Clearly, most of these patients were unvaccinated. I did see a couple of things that I'm going to ask Dr. Saag about in a minute. A lot of the three different patients had gone to 3 different urgent cares and had gotten one got a steroid Medrol dose pack, one got prednisone, and one got IM Solumedrol. And we talked about what we don't want to do those in the first week of the illness, and we'll go over that again. But some of these people were vaccinated, and I think it kind of lulls us to sleep to say these people cannot get the virus, and we'll talk more about that in a minute. Now, the one other thing I want to talk about, what we saw this weekend, what we're seeing is a change in demographics. Now, I don't want to compare this to 1918 because it's not that deadly, there's no question, but 1918 Spanish flu hit younger people. That's what we're seeing right now. I admitted 20-year-olds, 30-year-olds, and mostly 40-year-olds. I had 152. Everybody else was younger than 52. This is hitting that population, hitting hard. Several of these we intubated 40-year-olds because these are the groups that are not vaccinated yet. So I'm worried about that. I'm going to ask Mike what he's seeing in Birmingham, but before we do that, Mike, I got a call last night from a really good family practitioner in Trussville. A church over there had the 200th anniversary of their founding all last week. A lot of ceremonies. 70 people in that congregation have tested positive. This physician is infused with monoclonal antibodies, Regeneron, over 20 of them thus far, and we're seeing that. I got called last night. A friend of mine died here at a funeral, and now 2 people at that funeral have come positive. Now, they were both vaccinated. What are you seeing in Birmingham, Mike?
Well, David, it's very similar to what you're seeing. I will apologize. I'm your roving reporter, literally on the road. Hopefully you can hear me okay, but we're seeing something very similar. Seemed like July 4th was a spark, and now we have a fire, a wildfire that's going throughout the state in all regions. I would say that it was kind of a perfect storm where we had a fair number of vulnerable people in terms of not vaccinated, as you said, 2/3 of the population. A very contagious virus. Is Delta variant's now well over 80% of the cases that we're seeing, and it's 10 times more infectious than the COVID we knew from last year. And what that means is that only you have to be in contact with somebody for maybe a minute, and that exposure can lead to an infection. So you add those two things together, and a population of younger people who perhaps understandably said, well, this doesn't affect me. Well, this is not last year's virus, and it does affect them. So you put all that together, and we got this explosive case load, especially as people are trying to go back to normal activities because a month. Now we have to do a reversal. What I've seen, David, in terms of we, like you guys and like Dan and Huntsville, have monoclonal antibody clinics that was a little bit like the Maytag repairman back in June. There wasn't much going on. I covered clinic last Friday, and we had 16 people scheduled, and a few we couldn't accommodate, had to wait till Monday. But of those 16, half of them were unvaccinated, but the other half were vaccinated. They were not that sick, the vaccinated folks, but we were concerned about them because they were immunocompromised or had other underlying health conditions that made us unsure of what the next 3 or 4 days was going to bring. So we gave them monoclonal antibody, and to a person, they've done pretty well. But what we have is an explosive exponential growth. And I'll finish with an anecdotal story, and that is, I don't know about you guys, but last night I was watching the NBA Finals, and we all know the Milwaukee Bucks won, and good for them. And they haven't won in that city for over 50 years. So everyone was out in the street celebrating as if it was 1999, and no one was wearing a mask. They were crowded together. I looked online and saw 49% of Milwaukeeans have actually been vaccinated. So I'm confident that's going to turn into a super spreader event. And what you described at the church and what we're seeing elsewhere, the super spreader events are going to be much more common now, simply because this virus is 10 times more infectious. Dan, what are you seeing in Huntsville?
So I'd echo a lot of what Dr. Thrasher and Dr. Saag were saying. So we've seen roughly triple the number of hospitalized patients over the past 3 weeks up here in Huntsville. So we got near single digits in hospital, and we're not there anymore. And same with monoclonal antibody infusions. It was crickets in the clinic there for a little bit, and now we're doing teens near 20 infusions a day. And the patients are younger. So I worked a shift in the ER today, and I admitted 4 COVID positive patients in my 8-hour shift, and nobody was over 55. So these are people all with oxygen requirements, all going in the hospital. Delay to therapy was a big theme of it. I did not diagnose any of these patients with COVID. They all came in with known diagnoses, and none had sought or received effective therapy for their COVID infection until today. A lot of them had been put on antibiotics and steroids. One had been referred for infusion, but not gone for monoclonal antibody infusion. And all of them were unvaccinated. We've got a couple from my partners, a couple of people who have ended up in the hospital who have been vaccinated, but that's incredibly rare at this point. And it's sad because, you know, it's at least partially preventable, these hospitalizations. There's one other thing I'd say is a big difference between now and especially the initial summer surge that we had was that the hospitals are crazy busy right now. So, you know, we're seeing normal to increased from normal volumes of our normal patients, our surgical patients, our stroke, our cardiac patients are coming in the numbers that they were, if not higher, pre-COVID. Whereas we had a lull and some increased capacity in hospital a year ago, and that just doesn't exist right now. And so it's getting worse. And I think that the next 2 to 3 weeks, if not 2 to 3 months, are going to be kind of rough around the state. So,
You know, we've talked a bit now about what to do. And I think since it's been a little while since we talked about this, it's worth recapping the biology of how this virus causes infection. So initially, in the first 6 days, there's high levels of viral replication, a lot of infectivity, but that's the time when the innate immune response, specifically interferon, is active. If we give steroids in those first couple of days, systemic steroids, we blunt that response and the clearance of the virus is impaired, leading to a prolonged and actually worse clinical illness. So you've heard us harping on this, but it's really important when you have somebody who you think has coronavirus infection, the thing to do first is test. And if you confirm, not give systemic steroids right then, you can do other things like supportive care with inhalers. I've been using obviously Tylenol and some non-steroidal alternating. I typically have not been using anything else in terms of antivirals. I'd love to use remdesivir, but it's not orally bioavailable. So we're left with just kind of hunkering down in those first couple of days. If somebody's sick enough to go in the hospital and hypoxic, then we would start using systemic steroids, but that's usually not till day 8 to 12 when the innate immune response has gone down and the adaptive immune response, meaning antibody and that type of thing, is there. Of course, the one thing we can do in those first couple of days for those who are eligible, we've already referred to, is monoclonal antibody, and that is antiviral. And we're referring a lot of people, and those eligibility criteria have loosened up. Dave, you want to expand on that and talk about other things you do?
Yeah, I agree, Mike. And I know this is primarily a talk for docs as an outpatient, but we do have another a drug that's given emergency use authorization, Actemra. It's IL-6 inhibitor. I know most doctors aren't using that, but it's the same thing as the steroids. There's a wonderful time for it and there's a bad time for it. You pretty much want to use that like you would the steroids, day 10 to 14, I think is a sweet spot. I'd like to hear what you say about that. And of course, I used the inhaled budesonide early on. I think that helps. Now, like I've said, I use vitamin D. I've looked at the studies. I'm not convinced that there's overwhelming evidence or any evidence that it works. I have quit using zinc, Zithromax, doxycycline. I think the studies I saw, only 1% of patients with COVID have a secondary infection. What do you think about that, Mike?
Well, that's right. And there's a recent study of azithromycin that was a large study that was stopped by a Data Safety Monitoring Board for futility. In other words, it wasn't working. And I think you're right. We can do more harm than good. We definitely do harm with steroids. I think vitamin D that probably doesn't hurt any. I'm not sure it helps a lot. But the data on ivermectin, which a lot of people are talking about, there was a large 400 patient trial that was one of the few that actually showed a hint of efficacy, and that was just pulled by the publisher because of the suspicion of fraudulent data. So we put that one aside, and it's looking like there's not much efficacy of ivermectin. And Merck, the drug company that makes it, has even said, we don't anticipate that this drug works much. Dan, how about in Huntsville, when you're in the ER, you see somebody not sick enough to go in the hospital, what are you doing as you send them home?
Yeah, I would agree. It's mostly symptomatic care. So antipyretics, budesonide, things like that are really our go-tos. And then also referral for monoclonals as early as we can get it in them is when we like to do it. But not a whole lot more. We see a lot of people who are put on a lot of different things,
Right.
but they don't seem to do better being on them. And I would echo what you said. They get the side effect profile of the antibiotics when they have a viral disease. So it makes them have their respiratory symptoms and then, a little bit of diarrhea or nausea in addition to it. So
I think that, just to recap, that what the monoclonal antibody is it's an antiviral. It's basically the same type of antibody that our immune system would make after a vaccine, maybe 14 days after the vaccine. So we're basically giving them passive immunization, and that binds the virus that's being produced, takes it out of circulation, and shortens the duration and the severity of illness, and especially for people who are at higher risk, those who are obese, older folks, those who have underlying medical conditions, and it really does save lives. So there's been recent data underscoring that. One thing maybe we could transition to is just talking about, now that we know that this, I'll call it a surge in new cases, this explosion of new things we're seeing, what do we tell people about mask wearing? And obviously we're encouraging everyone to get vaccinated. The lieutenant governor came out today, good for him, and encouraged everyone to get vaccinated. But in the meantime, what about people who, even if they've been vaccinated, but certainly unvaccinated, what do we tell them about mask wearing?
Well, I'll take that, Mike. This is tough. We're not going to have a mask mandate in Alabama, at least. I'm confident of that. I told a group today, I hate to tell them this, but it was a bank group that called me. I said, I'm going to encourage everybody in the bank, customers and employees, to wear a mask until this thing is over. Now, I personally think this is going to burn through Alabama like Sherman through Georgia. It's going to be hard and fast. Probably, I'm predicting it will be over in 60 to 90 days because it's so contagious. And I said at this meeting, I said, if you're not vaccinated, you're going to get this virus more than likely. One of the questions, Mike, that several doctors have asked me, well, there's been another study, another suggestion of triple dose hydroxychloroquine helping. I'll throw that to you. We've talked about this a million times.
I think we can really put that compound to bed. It doesn't have any hint of real antiviral activity. It's an immune modulating agent, if anything, as well as being an antiparasitic, but this is a virus. And so I don't think there's any new evidence that's compelling. And I think we're better off really getting those individuals who are at risk to monoclonal antibody, following them carefully if they are not eligible. And then if they need to come in the hospital, then at that point giving remdesivir early, because unfortunately that drug is given too late. It's well after the virus is being cleared. So if you're going to put somebody in the hospital, get that right away where the virus might still be being produced. But the reason why remdesivir doesn't add a whole lot is because it's not timed right. It should be given like with monoclonal antibody, but it requires 5 days of IV therapy, which is impractical for an outpatient setting. So that's what I'm recommending. One of the things that I heard, I had a really good question today from a doc who was a medical student when I was a fellow, asking, okay, you talk about the vaccine, we get it if you're not had COVID, but what if you've had COVID? Do you still need? The answer was, you definitely have immunity from having had COVID, no question. Much better than never having it and not having a vaccine. But the intensity and the duration of the immunity is not as robust as a rule as when you get the vaccine. Plus, we know that the people who have had COVID and then get the vaccine have the most robust immune response of anyone. So 60 days or so after an acute COVID event, if you've not been vaccinated previously, that's the time to get vaccinated. Dan, what are you telling folks?
Yeah, I completely agree. And I'd echo the mask comments. I mean, there's a reason why we're all wearing masks in hospitals still. And I suspect that a good number of us are still wearing masks when we're out and about, despite being vaccinated. And it's not necessarily just to protect yourself, but to protect others, because we are seeing some less severe infection in vaccinated individuals. This way I won't spread it if I'm more protected by wearing a mask. Yeah, I encourage everybody to be vaccinated. We're actually exploring vaccinating our discharged patients from our ER as another way, because we have a little bit of a captive audience. So.
Dan, let me ask you a question too. Had a doctor asked me today, why are we vaccinating people if they can get still can get infected? What are you telling people when they ask you that, Dan?
I'll say less severe disease if you do get it, and less likelihood to be one of those super spreaders as well, and minimal to no potential for harm is the other thing.
How about you, Mike? How do you answer that question? Also, Mike, if someone's been vaccinated and their spouse comes down with a virus, do they need to be isolated, quarantined? I'm not sure. We may have lost Mike on the road. Can you hear us, Mike? Dan, I'll throw that to you while Mike comes back live. But the question is, I'm vaccinated. My wife gets diagnosed with COVID. We infuse her. She's over 65. Do I need to still quarantine?
Obviously, if you're symptomatic, yes, and I'd encourage those people to wear masks when they're around others. But the recommendations on that are fluid at times. But
I agree.
If at all possible, I'm encouraging those people to not be around others. But I think that the line is that they are not necessarily needing to quarantine like somebody who's unvaccinated.
I agree. What I'm telling people, try not to be around anyone who's unvaccinated, particularly riding in a car. Mike could tell you that's how he got COVID before we knew what was going on. I think that's important. Stay away. Don't eat out with people who are unvaccinated, because it's the unvaccinated people who are giving the vaccinated people the virus. And one other thing I also tell them, the studies show that it's very efficacious, but still up to 35% of people that have been has an mRNA vaccine can be infected. But the good news is only 5% will end up in the hospital, and much less even die. So, like you said, we're seeing about 97, 98% of people we're admitting to the hospitals with COVID are unvaccinated. Even though we're seeing a fairly large number of people who testing positive that are vaccinated, they are thus far doing quite well. Is that your experience? I think Mike may be back on the line.
Yeah, I am. Sorry, I went through a dead zone. But the bottom line is, you're right. The thing to reiterate is what Scott said earlier, that nationally there were 18,000 deaths in May. 17,850 of those deaths were in unvaccinated people, and that's all we need to know. That tells us that that the vaccine works and protects most people. If you're immunocompromised, you want to be protected and wear a mask, because you might not have as much protection. But the question about what do you do if somebody's spouse has got it and you're both vaccinated, there's no indication to quarantine. You have to isolate the person who's infected for the 5 to 10 days, whatever it is. But the quarantine is not recommended yet for people who are exposed if they're vaccinated. And so that's one of the things. But I would advise people just wearing a mask in the house. I think that was your question earlier. Sorry, I missed that.
Yeah, and one other thing too that I think we really want to stress, not necessarily to the ER, Dan knows this, but the urgent care. If people come in and they say, well, I've been vaccinated, well, that doesn't give them a free pass. If they're having sniffles, cough, sore throat, something to go into urgent care, really want to encourage our docs to test these people. Just because they're vaccinated, they don't have a get out of jail free card. You agree, Mike?
Yeah, that's right. And even though they might not get that sick, and the chances are they're not going to transmit necessarily to someone else, you definitely want to know if you got it again. So that it would be important for everyone who develops symptoms of COVID. And Delta seems to be more of the traditional coronavirus, at least early, with runny nose and sore throat, like a common cold initially. So be on the lookout for that. Get tested. If you're tested positive, contact your doc, even if you've been vaccinated, because there may be a reason to give you an antibody depending on what else is going on with you.
Now, Dan and Mike both, do you use the same criteria for giving monoclonal antibodies for someone who's been vaccinated and has tested positive and qualifies under the conditions for monoclonals?
We're not restricting it based on vaccination status. I'd say if I had one dose and I had a vaccinated and unvaccinated patient who were otherwise equal, I'd give it to the unvaccinated patient. But right now, I've got doses for both of those patients, so I'm giving it to both of them.
Mm-hmm.
Yeah, we had that same conversation 2 days ago, and we can't guess who's going to get in trouble, even if they've been vaccinated.
Right.
So just and by the time you find out if they're going to progress, it's too late to give it. So we've been giving it to folks, even if they're vaccinated.
Mike or Scott, I've had several questions about the Delta variant. Well, the patients a week ago that were vaccinated, I sent them off to UAB for DNA sequences, primarily just to see what's happening. And I do know that we've got 4 variants in Alabama. And I've quit doing it now. And doctors ask them, why don't you check for Delta? Well, about 80-something% of people are going to be Delta, and it's not going to change my therapy. We're not going to give them the bamlanivimab. We're going to give them Regeneron for the infusion. So there's no real reason to DNA sequencing from a clinical standpoint. Do you agree with that, Scott?
Yeah, I think that's generally true. I think sequencing helps us to keep track of what we have. It helps us find the next variant, whatever that variant may turn out to be. So there's certainly, spot indications for doing that. CDC, has reported as recently as yesterday that more than 83% of the new infections in the country over the past week have been the Delta variant. We don't really have the data to report what's happening in Alabama, but I don't think it's any different. I don't think we would find it to be much different anyway. Certainly, Missouri, Arkansas, those states were hit really hard, earlier. There's no question we're going to begin seeing it here. I think, think of genomic sequencing, for particular cases that are somewhat unusual in a way. If you want to, add that extra piece of information, certainly a good idea. We also like the fact that it just gives us a good picture of what's going on overall.
There's a lot of questions we're having about the kids, mask in school, all these kind of questions. Should we vaccinate kids? I know, Scott, you've got that plan for next week, so we're not going to delve in that. We're trying to not keep people too long on these calls. But what are your plans for the future, Scott, as far as education videos? Yeah,
I think this has been a great call tonight. We're looking forward to continuing to doing this. We want to do it again next week. I think as people are preparing for school to get back, it would be a good time for us to talk about vaccination of kids, to talk about the non-pharmaceutical interventions like mask and distancing in the school environment. Very soon, we also want to have other experts on additional calls. There are things like the questions that people have around pregnancy, around infertility, about when we're going to see full approval for these vaccines, when we're going to have expanded eligibility in terms of age categories for these vaccines. A lot of exciting things we can talk about. So hopefully we will get together again next week and then continue to do this on a regular basis.
Dr. Aruna, we really appreciate you putting this together and been so great educating the doctors and the public for what you're doing. We appreciate that.
This was fantastic. We are very thankful for you guys as the experts to take time to educate us as physicians, as well as the public, to watch out and take care of their own health, as we know the Delta variant is very much here. Thank you for your time. Look forward to the next one.
Thank you.